In 2016, First Nations peoples accounted for over 12% of the Canadian-born cases of tuberculosis, even though they comprise only 2.4% of the population. The TB Journey Determinants Map for Northern First Nations communities is an educational resource for service providers to TB-affected First Nations communities. The map visually depicts key stages in a typical TB patient journey as they move from exposure to treatment completion and the different healthcare-related, social, and First Nations determinants of health. Social determinants of health are the non-medical factors that influence health outcomes. They affect individuals at all stages of the life course and include factors such as income, education, food insecurity, and housing. How do the social determinants of health affect First Nations communities? The history of relocation, the establishment of reserves, and the residential schools era has put the First Nations population at risk of poorer health outcomes and contributed to the First Nations TB experience. However, these are not exclusive to the past. The ongoing processes and intergenerational effects of colonization continue to have a systemic influence on First Nations people in Canada today. The following are some of the determinants of health that contribute to the spread of TB in First Nations communities. Employment and income. The WHO has classified tuberculosis as a disease of poverty, and First Nations peoples in Canada experience the highest levels of poverty, with about 25% living under the poverty line. Housing. Inadequate housing on government-sanctioned reserves facilitates the spread of tuberculosis due to poor ventilation and air quality in the home. And approximately 25% of First Nations adults live in overcrowded homes, which is a risk factor for infection and disease. Access to health providers and services. First Nations populations face barriers in access to quality, culturally informed healthcare, service providers, screening, and continued treatment. These may increase the likelihood of developing active tuberculosis. Due to the ongoing ideologies and policies of colonialism, First Nations populations are disproportionately affected by tuberculosis. The TB Journey Determinants Map for Northern First Nations communities represents the importance of social determinants to support the health and well-being of First Nations peoples.